Good afternoon. I think we'll get started now. My name's Dan Petticourt. I'm the Public Health Director for Contra Costa County, and I'm joined today by Dr. Radhakrishna, one of our Deputy Health Officers. We would like to share that we believe COVID-19 is circulating in our community. Currently, we have 9 Contra Costa residents who've tested positive for COVID-19 and 1 additional presumptive positive that is waiting for CDC confirmation. This brings the total at this time to 10. We are also continuing to follow 1 traveler from the Diamond Princess cruise ship who's waiting for negative test results before being released from the hospital. Let me summarize our 9 cases and 1 presumptive. 6 of those had no known travel history outside of the U.S. or known contact with another known positive coronavirus case. 2 of the 10 were passengers aboard the Grand Princess I cruise ship, not to be confused with the Grand Princess II that is harbored at the Port of Oakland. 2 of these cases, 2 additional cases, had contact with another known positive, and we do expect these numbers to grow in the days and weeks ahead. I'd also like to announce that 6 passengers from the Grand Princess II ship, the one that is harbored off the Port of Oakland, are now currently in Contra Costa hospitals. They're not in serious condition, and we have sent their samples in for testing at our local public health lab. I will also mention that our public health lab has received 1,000 test kits, has ample capacity to test all of those folks who are currently in the pipeline, and that it has been announced that 2 commercial labs will soon be online to provide testing for hospitals and clinics, which will greatly increase our local and regional capacity, which may well be needed in the coming days and weeks ahead. Our Public Health Division has been very busy monitoring people with COVID-19, doing what we call contact investigation. They interview patients and those they've had close contact with. As a result of these investigations, we have quarantined a number of people and isolated others. Isolation is used for positive cases. Quarantine is the term we use for folks that are waiting for their test results. 140 of those individuals were associated with the Grand Princess I. We have now screened over 250 passengers that have come in through SFO, and fortunately, not a single one of those have tested positive. I believe we will now be increasingly focusing our attention on community-acquired cases. Given the level of coronavirus in our community, Contra Costa is shifting from a strategy of containment to mitigation. That means we are acknowledging that our efforts to isolate people who are sick and quarantine people who may have been exposed may no longer be enough. Today, Contra Costa is taking additional steps to slow the spread of the novel coronavirus and minimize its impact in our communities. Today, the Board of Supervisors declared a local emergency, and CCHS is also issuing new guidance to our community, which Dr. Radhakrishna will now talk to you about.
Good afternoon. We understand that these recommendations may substantially impact our lives and be difficult to implement. We considered them very carefully in consultation with the state and with other counties who have taken similar actions. Given that we now know the novel coronavirus is spreading in our county, this is a critical time, perhaps the best and only time, for each of us to do our part to protect the community and decrease the spread of this virus that can affect especially the elderly and those with chronic conditions. Our guidance comes from the health department, and these are things that we recommend starting today. We expect these measures to be in place for 2 weeks initially while we test more, gather more information locally and regionally. Respiratory viruses, like the novel coronavirus, need people to be close together in order for it to spread. Therefore, our recommendations involve social distancing. This is a public health strategy that limits the closeness and the number of interactions that people have so the disease spreads less often. As mentioned, the people at most risk are those over age 50, increasing with every decade of life, and those with chronic conditions like heart disease, lung disease, diabetes, cancer, or weak immune systems. Contra Costa Health Services and Public Health strongly recommends that all large community events be postponed or canceled. That means gatherings where 50 or more people would be within an arm's reach of each other, such as concerts, sporting events, celebrations, religious services, and other community events, with special focus on those that have high attendance from the elderly or those with chronic conditions. If a large event does take place, organizers should review the guidelines from the California Department of Public Health on mass gatherings and ways to mitigate impact and spread. Employers are encouraged to suspend non-essential travel and relax sick leave rules. This means canceling conferences and big meetings and minimizing the number of employees that are working within an arm's reach of each other. We urge employees to stay home when sick and for employers to be flexible about sick leave. Please do not require a doctor's note for sick employees to avoid further strain on the healthcare system. Schools. Public health is working very closely, and schools may need to prepare to postpone, alter, or cancel certain events. We have been in close communication with school administrators from public and private and religious schools across the county and have briefed them on the state guidelines for various scenarios and how to communicate with us so we can make the best decision to protect our student body and our community. Do not go to school if you are sick. Public health will work closely with schools in the districts to determine if a school dismissal is recommended. Parents should prepare backup childcare plans in case there is a school dismissal. The best way to protect ourselves, prevention is in our hands, and that's old-fashioned hand and respiratory hygiene. Because this coronavirus is new, humans do not have immunity to it, and we do not have a vaccine for it yet, like we do for influenza. The most important thing is for everyone to wash their hands frequently and correctly. That means 20 seconds between your fingers, front and back, your wrists, your nails, your thumbs, with soap and water. If you have to cough or sneeze, sneeze into a tissue, and then wash your hands again for another 20 seconds with soap and water. If you have to cough, don't use your hand, cough into your elbow. And if you don't have access to soap and water, you can use an alcohol-based gel of at least 60%. Common household cleaners are fine to clean high-touch surfaces that should be done at home and at work and in schools, such as doorknobs, handrails, and computers. Avoid touching your face. Humans touch their face on average more than 20 times in an hour, and touching your eyes, nose, and mouth can help spread all viruses. There's a lot of questions about masks, and our recommendation and the evidence suggests that these paper masks are only for sick people with symptoms. They are not helpful if you are healthy. They prevent respiratory droplets from passing to other people, but they will not prevent you from getting infected, especially if you're not washing your hands and you're touching your face. Most importantly, if you are ill, just don't risk it. Stay home. Don't go to school. Don't go to work. And call your healthcare provider before going in, because many of your issues could be dealt with over the phone. Right now, we are facing, as our Health Services Director, Anna Roth says, 4 separate epidemics. The first is the novel coronavirus. The second is an infodemic of misinformation. The third is fear, and the fourth is stigma. And I'd like to speak briefly about all of them. For the first epidemic, coronavirus, we have seen viruses in the past. SARS, MERS, influenza. We are prepared, and we know what to do to protect you. But when it comes to the infodemic, a lot of people are getting information on social media and from untrusted sources. That can create unnecessary panic and guide people to make poor choices that could put themselves and their loved ones at unnecessary risk. choose facts over fear and trusted sources of information. You can go to our website, cchealth.org/coronavirus, for updates in English and Spanish with all of our guidance documents, including videos on how to wash your hands. The third epidemic is that of fear. What can happen when diseases spread to multiple continents is it can affect supply chains, and what's most important is that people feel confident in their preparedness plans. Now is the time to prepare your earthquake kit, which can help you for any type of emergency. To prepare to have enough, couple months worth of medicines, a couple days worth of essential items, and we ask that you choose facts, not fear. Finally, the fourth epidemic is that of stigma. We've even seen in California kids getting bullied in high schools for being Asian looking or for having coughs. Now is the time that we must pull together as a community to support each other. So we ask that you choose solidarity, not stigma. Finally, we're in this together. If you know people who may be ill at home, there are many ways you can help them out without having close contact. Helping them run errands, cooking a meal, helping them out with things they may need, checking in over phone or video to see how they're doing. Now is the time to be neighborly and to love, not leave people behind. Contra Costa Health Services is here to address all of these issues and work closely with you to support and protect the health of our community. Thank you.
All right, so if you have any questions, go ahead. We're going to repeat in Spanish.
Doctor, you said that these people have humans have no immunity, but yet we keep hearing that there's so little known about this. How can you say that then? How can you substantiate that we actually don't? When some people have recovered already.
Yeah. We're learning a lot about the virus. What we do know is that the vast majority of people, more than 80%, have very mild symptoms, that it doesn't affect children in a severe way. 0 children under the age of 10 have died internationally. We're getting some data ahead of what's happening in the US from China, from Iran, from Italy. We're reviewing the literature. We're working closely with our international, federal, state, and regional partners to review the best science available. And we want to err on the side of caution. Now is our chance to take the measures to prevent the spread. But when it comes to this virus in particular, we have experience with other coronavirus viruses. For example, MERS and SARS that we have data from the past. While humans don't have immunity to it now, there is a chance that we can develop a vaccine, but we don't know how many months away that may be. Therefore, taking these measures early can prevent the spread. We've learned a lot from influenza in the past. We had a pandemic just 11 years ago, and we learned about how to handle things with schools, with the public, with business, with travel. Now is the time to dust off those flu pandemic plans and implement those great recommendations to decrease taking unnecessary risk.
The focus is taking every available precaution and doing everything possible now to slow it down. Why not close the schools?
Great question. So we've actually learned from reviewing the literature on what was the impact of closing schools 11 years ago during the flu pandemic. And what we saw was the greater social and economic benefit wasn't necessarily valued and worthwhile. This is a very serious decision, and every county may move at different steps. We have strong guidance from our state for various scenarios, and we will work closely with their schools to decide if and when it's advisable to close a school. For example, closing a school can be very disruptive, not just to education, but to children's lives. Many families rely on those schools for food and nutritious meals, for a safe place to be, for social support, and closing a school is something that we will advise very carefully on and may be different across various counties over time.
One more follow-up from a couple teachers that I heard from today. They questioned that, but they also said that they don't think they have the supplies on hand to do the kind of things you're asking them to do, extra, wipes and hand sanitizer, things like that. Are you making an effort to make sure that those schools have the resources to be safe if you're going to ask them to be there?
We've briefed all school administration leaders on recommended sanitary practices. Like I said, many of them are old school, reinforcing hand washing, having hand gel available, cleaning high-touch surfaces more frequently with common household cleaners. And schools are briefed on what they can do to protect both the student body as well as staff.
So there's a school, Mira Vista, that parents got a letter today that there was a student at the school who had come into contact with someone with the coronavirus. And the school sent out a letter to parents stating that the school would be beginning cleaning. But we've seen at schools in San Jose, South Bay area, that they're doing deep cleanings. Parents are asking, why aren't they doing a deep cleaning of this particular school if the student was there, instead of just a regular, normal cleaning process?
We're getting a lot of concerns about first, second, third hand potential contacts with people. Public health does very rigorous methodology on something called contact tracing. What that means is it's not the telephone game of somebody heard somebody may have been in contact with somebody with a cough. We follow protocols. We spend up to 8 hours for every case tracking down who they may have had contact with. And as soon as we have testing and a confirmed positive, we notify all those involved so they can take the safe and necessary measures. When it comes to cleaning, we defer to the schools on their practices and timings and techniques, but we have offered guidance that's posted on our website from the CDC and the state.
What do you think you could change your stance on what schools should be doing, whether they should not be in session? When could that happen? When could it happen that you should say, hey, you recommend that schools not be open?
This is a very local decision. Disease can be very local, and so we'll be looking school by school before even going to district by district and working closely with school leaders to make the right decision and advise them. It's up to a school to choose what they want to do. They know their community well. We're here to offer science and best practice recommendations. Again, looking at past experiences we've had with this and what's best for the overall community.
Doctor, we've seen tens of thousands of people die from the regular flu. We haven't seen that just yet. What do you make of that?
So it's still too early to tell and truly compare influenza with coronavirus, but we do have some data from China and Italy and Iran. And what we're seeing is it's something that we do need to take carefully, especially in the elderly and those with chronic conditions. Now, those who are younger and healthy may not take it as seriously, but they could certainly contract the virus and pass it to those who are more vulnerable, which is why our previous guidance was focused on those who are elderly and with chronic conditions, and our current guidance and measures for precaution and social distancing are to further that spread.
Those numbers are quite different, though.
They are, and we actually don't know at an international or a local level what is the true fatality rate, what is the true attack rate or transmission rate. There are studies coming out every day, and we're watching them carefully. But we do know from epidemiology, the study of how disease is transmitted in communities, that when you take strong preventative measures early, it can really decrease the amount of social disruption, disease, death, and impact on our healthcare system. We see some of our neighboring counties starting to do this as well, San Francisco, Santa Clara. As Dr. Dan Petticord mentioned, more than half of our cases are from community transmission, so we take this seriously.
Can you say and spell your first and last name?
Dr. Rohan, R-O-H-A-N, Radhakrishna, R-A-D-H-A-K-R-I-S-H-N-A.
All right, if that's it, does anybody need Spanish?
Yeah, we'll do it all the day.
Okay, do it after, so thanks for coming, everyone. Yeah, good.
So if you don't mind, can we do the Spanish here, because I'm gonna need it as well? Do you have who's gonna do it? You are. Okay, yeah, can we take a minute and do that?
Yeah, we'll do it.
Yeah, oh yeah, I'm sorry, that's what he'll do the Spanish right here. It's
That is all. Yes.
Listo. we're done. Oh, no, they're just busy. They're reset.
Okay.